Welcome to this edition of Silver Sneakers Boom Muscle. Over the past few weeks, I've been developing a little bit of left-sided chest pain with exertion, sometimes without exertion, which is always an ominous finding. It feels somewhat like a muscle ache, although in certain things I do, I don't feel it at all. So I've been scheduled by my primary care provider to get an exercise stress test in a couple weeks. There's always the caveat at 70 years old or at any age for seniors, you can develop heart disease, narrowing of the coronary arteries, which often presents with a condition called angina, which can be a chest pressure, ache, pain. Sometimes it's in the chest, sometimes it's in the left arm, sometimes it's in the right side, right arm, shoulders, neck, head. It can present in a lot of different ways. The hallmark is that it comes on with exertion and goes away after a few minutes or so of rest. It can occur at rest, and it can be a very dangerous condition that can lead to a heart attack, instant death, or other problems. So we have to take quite seriously. So for the next couple of weeks for these videos, I'm going to avoid high intensity exercise. I am going to walk on a treadmill because it's a test that it can be pretty intense. Usually they use a protocol where they increase the angle of the treadmill and the speed of the treadmill about every 3 minutes, with the hope to get the test completed in 10 to 12 minutes, getting your heart rate up to a goal somewhere between 75 and 90% of your predicted maximal heart rate. So I'm going to monitor my pulse while I'm on the treadmill, take it slow, try and last for about 20 minutes, and see if I can get my heart rate somewhere between 120 and 130 without the onset of any symptoms. If I develop any symptoms, I immediately stop, rest, make sure I'm stable. Also, I have to take other precautions, avoiding being too isolated, doing hard work, or whatever. So, for this video, I'm going to go on the treadmill. I'm not going to show the whole time, I'll show the final result, and then some exercises you can do even if you don't have the medical clearance yet to engage in specific exercise. So while I'm waiting to get this sorted out, where this chest pain's coming from, I have at this point a stress test scheduled in nearly 2 weeks. I'm going to try and just maintain, do some exercise, try and keep my exertion level below a perceived exertion level of 7, but also when I've done a treadmill before, it can be pretty uncomfortable just getting your body moving at those speeds if you're not used to running on an incline. And the point of the test is to get through it pretty quickly to determine if you have changes in your electrocardiogram, your blood pressure, symptoms, and other factors. So on this test today, this exercise session, I'm going to keep it kind of low, try and get my heart rate up to maybe 70% and about the 120 range. If I develop symptoms, I'll just stop at that point and rest and see if I recover. So on that brief treadmill protocol, I got my heart rate up to 120, kept it going for about 30 seconds or so, but I was at a level 14 and the speed of 3.5, having to jog a little bit. Before doing a treadmill, you want to make sure you're wearing comfortable clothes. For men, you probably won't have a shirt on because of all the leads, and women probably just a bra and maybe a light covering. But mostly it's quite an uncomfortable test. So if you want to wear shoes that are most comfortable for you if you do have to run a little bit or jog a bit. Move your hips quickly. Again, it's a test that you hope to get through quickly with no abnormalities being shown on the cardiogram, blood pressure, or other symptoms. Like in my case, I'm waiting nearly 2 weeks to get this test to demonstrate whether this chest pain I'm having is from my heart or some unknown reason. So there's things I want to avoid. Doing a lot of exercise with my upper body, first of all, that puts an extra or harder strain on your heart, as opposed to core exercise or even some lower body exercise. You want to avoid lifting heavy weights, but you can do light exercise and again, to that perceived level, maybe 5 or 6, probably no higher. You want to continue on your regular medications. However, I would avoid sildenafil or any other erectile dysfunction medication, because if you were to have an event, that can interfere with treatments like nitroglycerin, which can give you a prolonged low blood pressure, which can be quite dangerous. So until you've been cleared, you want to avoid those. So for the remainder of this workout, which really doesn't fit the criteria for bone muscle, more just a general sort of light exercise session, just going to do some mobility exercises. I did want to add that the stress test and the symptoms for cardiac chest pain are more accurate for people who have pre-existing conditions that might lead them to higher risk factors like high cholesterol level, diabetes, age, history of smoking. So it's less accurate for younger folks, people with no pre-existing conditions, or the pain isn't quite sort of typical. Now suppose I come up with a positive stress test. The standard of care, in my opinion, would be to follow that with a cardiac catheterization as soon as possible, hopefully immediately, to see if they can identify if I have a very severe narrowing of a coronary artery, see if they can place a stent, or if I have to undergo bypass surgery. In modern medicine, I'm not quite sure what will happen if I have a positive test, whether they'll send me home on a medical treatment, like a baby aspirin or something else. But again, the first symptom for a heart attack in most people is sudden death. They don't have the luxury of having some preceding chest pain or other symptoms leading up to it. The risk, even if it's a distal artery, far away from the main arteries of the heart, if it gets blocked, it can cause damage to the heart muscle, cause arrhythmias, which can be fatal. So just hoping to get through this, and I hope to get back to doing full burn muscle in a couple of weeks.